right, guys, let's move on to the second step of the nursing process, which is diagnosis. So, in the diagnosis step of the nursing process, you're going to be identifying how individuals, groups, or communities respond to problems, identifying factors that contribute to or cause those problems, which is called the etiologies, and identify resources or strengths on which the individual, groups, or community can draw. So, those are the things that you'll be doing during this step of the nursing process. Let's look at diagnosis a little deeper. We've already done the assessment portion in the green and the yellow portion where we were drawing conclusions about Miss Carla Tompkins. So we went ahead and we clustered our data, we drew the lines, we said, there were three diagnoses that we thought could be a problem for her. And then now what we're going to do is we're going to start going and actually working with the diagnoses. And we're going to create a list of suspected, which we did. We're going to rule out any that we think are maybe not, important at this point or similar problems. We're going to start to name them and we're going to start to validate them. So, types of diagnoses. In order to know if you're using a medical versus nursing diagnosis, you need to know the difference. So, a nursing diagnosis is going to describe a patient problem nurses can treat independently. Medical diagnoses are problems for which the physician directs the primary treatment. So, kind of looking back or thinking back to our assessing presentation, we talked about nursing assessments versus medical assessments. And we said that, a physician or a nurse practitioner or a healthcare provider within their scope is going to deal with the pathology, maybe prescribing medications, ordering tests, prescribing therapies such as physical therapy or speech therapy. Nurses, on the other hand, are going to look at how the patient's responding to the problem and try to come up with diagnoses that mimic that. So somebody, for instance, that has, I think we talked about a fracture, the doctor is going to deal with the fracture itself, but the nurse is going to deal with responses to the fracture, such as pain, limited mobility, anxiety, fear, things like that. Then we have collaborative problems where those are managed by both the physician and the nurse. And so you'll see something like with a fracture, just say, and the pain, the nurse is going to be doing some things and the doctor is going to be doing some things, and they're going to be working together. So the doctor maybe prescribes the medication and the nurse is going to administer it, and they're working collaboratively. So we've done some of these steps already, the 4 steps to interpreting and analyzing data. We already recognized significant data by highlighting that in the case study. We recognized patterns or clusters and we clustered those together. It was nice that they were one below the other, and we just drew lines and said this is what we think it equates to. And then we identify strengths and problems. So let's talk about Carla's strengths. We don't really know necessarily, but if it were a patient that we were dealing with in the facility, we would talk to them about their resources, their support system, things like that, and that might change the outcome of the care plan. Obviously, somebody who has more resources and support potentially might meet the goals a little bit better than somebody who struggles with those things. Then we're going to reach our conclusions. We're going to determine, is there no problem, there is possible problem, actual or potential, or problems other than nursing. And we went ahead and we determined that there were some actual or potential nursing diagnoses that we could use for Miss Carla Tompkins. So a little knowledge check here. A nurse decides that a patient has a possible problem with high blood pressure. During which step of data interpretation would this most likely be determined? Recognizing significant data, recognizing patterns or clusters, identifying strengths and problems, or reaching conclusions. So if you said reaching conclusions, you are absolutely correct. If we're thinking that a patient has a problem with blood pressure, high blood pressure, then we've already worked through the other steps listed there and we've already reached a conclusion. Okay, another little knowledge check here. True or false, Yolanda knows that the best source of information regarding Mrs. Tompkins' care is the surgeon. Hopefully you said false there. We know that based on our assessment presentation that we went through, that the patient is actually going to be the best source of information, unless the patient's unable to do so, but Miss Carla Tompkins is able to give us all the information we need. Let's talk about the different types of nursing diagnoses. We have 5 different types that we're going to be looking at. We have actual, risk, possible, health promotion, syndrome, all of these must be NANDA approved. So you can't look at a patient and come up with a diagnosis on your own. You can definitely cluster the data and identify problems such as pain, mobility issues, things like that. But then what you have to do is you have to then reference the nursing diagnosis handbook and make sure that the diagnosis that you would like to give to the patient is NANDA approved. So I'm going to show you how to do that in a little bit. So let's talk about these in a little more detail. What we did for Miss Carla Tompkins is we came up with an actual diagnosis of pain and maybe a psychosocial such as hopelessness or depression, and we came up with a risk for diagnosis, which was a risk for infection. We didn't have any possible diagnoses. We didn't have anything that we thought might happen, but we needed more information. I think we were pretty clear on what we were going to be doing. Health promotion diagnoses are an example would be a patient states that they want to eat better, or they want to have a change in their lifestyle, or they want to stop smoking, or something like that. So it would be something to where you could say that they would like to have an enhanced nutrition as evidenced by patients stating, I would like to eat better. So it's basically saying the patient wants to do something better, health promotion wise, and I know that because they stated these things or I saw these things. And then syndrome would be there's not a lot of syndrome diagnoses, but there's like a post-traumatic syndrome diagnosis that you can use for somebody who's been through a traumatic event. We don't typically use those a whole lot in a general med surg area, but you might use those more in mental health or a setting where you're dealing with people who are coming in with more syndrome type um, problems. Okay. Right, once again, just remember every diagnosis that you use has to be approved by the North American Nursing Diagnosis Association. And I don't care if you know that or not. That's kind of nice to know information. Might win you Jeopardy, I don't know. But just know that it has to be NANDA approved. Okay, types of diagnoses. So let's look at our actual diagnosis first. That's a three-part statement. It's going to contain a label or a problem, etiology or the cause, and defining characteristics or the signs and symptoms. Three-part statement. Okay? The risk for diagnosis is a two-part statement. We have a label or a problem and an etiology or a cause. The reason why we don't have signs and symptoms is because if somebody is at risk for something, then they shouldn't have current signs and symptoms. So if they have current signs and symptoms, then it becomes an actual diagnosis. So a risk for diagnosis is a two-part statement because they haven't developed the problem yet. Then we have health promotion. That's a two-part statement. I gave you an example before, but that's going to be something like readiness for enhanced nutrition. And then the defining characteristics would be a sign or symptom. So typically it's something the patient states. So it would be readiness for enhanced nutrition as evidenced by the patient stating, I would like to eat better. That's how you work a health promotion diagnosis. And a syndrome is a one part. You just simply state the syndrome, which, like a post traumatic syndrome, would be a diagnosis for a patient. Formulation of the nursing diagnosis. So remember, just to reinforce what we just talked about, the problem is the label. It's identifying what is unhealthy about the patient. Etiology is to identify factors maintaining an unhealthy state or the cause, and defining characteristics identify the subjective and objective data that signal the existence of a problem. Okay, and remember, subjective is patient states, objective is observed or measurable. So let's look at these for our patient. The top one is pain. We have pain related to surgical procedure as evidenced by patient stating 7 out of 10 pain and patient is grimacing in pain. So you see we broke it up into three parts, and I would suggest as you're learning how to do these that you put the three parts there and make sure you fill in each of those parts. So label is pain, etiology is surgical procedure, and defining characteristics is patient states 7 out of 10 pain and the patient is grimacing. Perfect. And then you put it into one statement there at the bottom. Another one, we didn't identify Carla, Miss Tompkins, as having a risk for impaired skin integrity, but if you wanted to use that one, you would just say risk for impaired skin integrity related to limited mobility, and more time in the bed. So that's how you would write a risk for diagnosis. You see that there's not the defining characteristics because she's at risk for it and not having an actual problem. Let's do a knowledge check here. A patient who admits to smoking 2 packs of cigarettes a day is diagnosed with lung cancer based on his symptoms and a series of test results. Which of the following is the etiology in this scenario? Would it be lung cancer, test results, smoking cigarettes, or the subjective and objective data? Okay, if you said smoking cigarettes, you're absolutely correct. We're going to say that that's the etiology because in this scenario, diagnosed with lung cancer based on symptoms. So, with the common errors, this is not something I necessarily test on, but you want to make sure that when you are writing nursing diagnoses that you reference this and make sure that you're not doing any of these things. You never want to say anything in a nursing diagnosis that's legally inadvisable. You never want to put judgments in there. You never want to, state that they have this problem because they didn't eat correctly or something like that. You want to make sure that you're using very professional terms and that's typically very objective and factual. You want to make sure that you're writing nursing diagnosis for things that you can actually help with. So sometimes you can't help with certain things, and you need to just be okay with allowing the patient to have those things and moving on to things that you can help them with. Okay, and then just make sure that you don't include medical diagnoses in a diagnostic statement. So um, if the patient has a diagnosis of, just say we're talking about even the example, the question we just did with the lung cancer, a nursing diagnosis would never say lung cancer. It would say a response to the lung cancer. So maybe the patient has respiratory concerns. Okay, that's a response. So impaired gas exchange related to chronic lung disorder, as evidenced by whatever signs and symptoms the patient has. So you want to make sure you're not saying the lung cancer in that diagnostic statement because then you're actually using a medical diagnosis and we want to avoid that as much as possible. Let's do a little knowledge check here to kind of look through that a little bit more. Which of the following nursing diagnoses is written correctly? Child abuse related to maternal hostility, breast cancer related to family history, deficient understanding related to alteration in diet and pain, or imbalanced nutrition related to insufficient funds in the meal budget. So if you said D, imbalanced nutrition related to insufficient meal funds in the meal budget, you are absolutely correct. If we look back at these, the first one contains a judgment statement that there's maternal hostility. We never want to put that in a nursing diagnosis. In addition, child abuse is not a NANDA approved nursing diagnosis. In B, you see breast cancer. Like I said, we would never use a medical diagnosis within a nursing diagnosis, so you can knock that one out for that reason. Hopefully, maybe you got it down to C and D and you were kind of going back and forth, but deficient understanding is not a problem. Deficient knowledge is a NANDA approved nursing diagnosis, but deficient understanding is not a label or problem statement that you would use for a nursing diagnosis. D, the imbalanced nutrition related to insufficient funds in the meal budget, is basically saying their nutrition is imbalanced because they're unable to and it might be something that they state to you that tells you that they don't have enough money to really pay for different foods that would enhance their nutrition. Okay, so let's go back to Miss Carla Tompkins. We see that in addition to her history, she's in pain. We know that she rates her pain at 7 out of 10. She also has been refusing to get out of bed due to the pain. Her history includes diabetes type 2, below the knee amputation. She's post op and she's there rehabbing with PT and OT. What are some nursing diagnoses for Miss Carla Tompkins? Now, if you think back to our last presentation, in the assessing portion, we went ahead and we clustered our data, and off to the side, we put pain, we put risk for infection, and we put powerlessness, and we talked about some other psychosocial. We thought maybe depression, hopelessness, powerlessness, something along those lines. So, what we're going to do now is we are going to go to our book. Okay, so we're going to go down here. Oh, so what you do is you sign into Lippincott. Okay, then here's your content. You can actually sign into any book, but I think just to be safe, we'll sign into our fundamentals book, which you guys have been using. And what you're going to do is you're going to hit launch here. And it's going to open it into our Lippincott book. We're going to go into content here, so you can see right here content. And then what we're going to do is we're going to click in on this left-hand side here, right here. You see this pink one? It says Lippincott Advisor. We're going to click into that. And when that opens up, we're going to go in. This gives you all of your extra books used for clinical. You have some of your books like your lab book, your drug guide. We're looking for our care planning book, which is right here, problem-based care plans. Click on that. Then what you're going to do is you're going to these are all the actual NANDA approved nursing diagnoses. So you can see that's the A's, that's the B's, that's the C's. So you can, kind of go through each of these and see what, what they all are. What we need to go under is, I believe, comfort, which is over here. Okay, if you know what letter it starts with, you can definitely find that, or you can just look in the list. But comfort, I know, has to do with pain. So I'm going to click on that, and I'm going to go to acute pain here. And what you're going to see here is you're going to see that in this acute pain, we have the patient will verbalize or demonstrate relief of pain. Sounds pretty good for Miss Carla Tompkins. And here are some interventions that we'll do for her. And when we get to the interventions area, we can refer back to this so you remember. Okay, so we're good there. We have validated that acute pain is going to be a good NANDA diagnosis. So we had put pain before, but actually it should say acute pain because there's also a chronic pain. So what I'm going to do now is I'm going to show you something else. If you go to the this here, this is going to be what you use during your clinical. It's called the concept map. What you're going to do with the concept map is you're actually going to fill it out for the patients that you take care of in clinical or in simulation or whatever else you're doing. So I thought as a good way to kind of get you guys started is I'd show you how to fill out one of these for Miss Carla Tompkins. So what you're going to do here, under the nursing diagnosis, you are going to, whoops, and actually we want to do nursing diagnosis 1. We're not ready for 2 yet. There we go. Okay, so what you're going to do is you're going to go ahead and we're going to write acute pain. And you can just write this on your paper for now. Related to surgical procedure. Okay. And as evidenced by, what did we say for that? We said patient states 7 out of 10 pain and patient grimaces with movement. So right there, you guys wrote your very first NANDA approved nursing diagnosis. So perfect. So we have acute pain related to surgical procedure, and then we have patient states 7 out of 10 pain and patient grimaces with movement. Perfect. Okay. So what we're going to do then is we're going to go to our nursing diagnosis 2, and we're going to write the next one. Let's do our risk for. So we're going to do risk for infection related to open wound. We could even write secondary to surgical procedure. And we don't have an as evidenced by, and if you remember, risk for diagnoses are 2-part statements. So you remember that a risk for, here's our first part, here's our second part, And if we go back up, we see that this one is a three-part. 1, 2, 3, because it's an actual diagnosis. Okay, so let's go back to here. And we'll go ahead and stop there. So we came up with 2 nursing diagnoses for Miss Carla Tompkins. Next, we'll be talking about planning. So when you're ready, move on to the planning section of the lecture.